Hello, and thank you for joining us. My name is Leslie Harrison Neal. I'm the founder and director of Community Bridges to Success Incorporated. We are a non-for-profit organization based in the Bronx. We focus on health and wellness. Today, I am pleased and honored to be joined with our interns that we have that have worked with us during the summer, along with Dr. Brittany Miller, and we plan on discussing health and wellness and how it affects young Black women. And I have my co-moderator with me, Miss Brianna Smallwood.
Hi, my name is Brianna Smallwood, and I'm an intern at Community Bridges to Success Incorporated for the summer, and I'm looking forward to this conversation.
My name is Tatiana Allen. I'm also an intern at Community Bridges to Success Incorporated, and I'm glad to be joined by Ms. Miller.
Hi, my name is Norquez Gomez. I'm also an intern for this summer, and I am a high school senior, and I'm looking forward to be here.
Hello, my name is Sky Harris. I am also an intern in this organization, and I'm looking forward to this conversation.
My name is Nairi Frazier. I'm also an intern.
Also joined by Ms. Cachet Minot, who is interning with us as well. I do want to say before I introduce Dr. Miller, you ladies have been very kind in introducing yourself, but you haven't told a full story. Tatiana is graduating and will be in the fall attending Howard University for journalism and communication. Brianna Smallwood is graduating and going to college to become a psychologist, and Ms. Minot is also attending her second year at Boston University, where she's majoring in neuroscience. So with that, we just want to be able to embrace and also say, hey, ladies, we're talking with our future doctors here and our writers and our ladies here who are still discovering themselves and where and what they want to be in life. Okay, and with that, we introduce Dr. Miller.
I am a health psychologist, although not a practicing health psychologist. I am not a clinician. I am more of a research and community intervention psychologist, and I am a project director for Cancer Health Equity Initiatives with the BOLD program, which stands for Bronx Oncology Living Daily. And it is a psychosocial wellness program that focuses on providing wellness and psychosocial support for cancer patients and their families living in the Bronx. And we are part of the community outreach and engagement arm of the Montefiore Einstein Cancer Center. So happy to be here with you ladies today.
Oh, thank you. So let's just dive into it. Who has the first question?
So my first question is, what are some preventable actions that young women can take when it comes to illnesses such as breast cancer?
Yeah, so a lot of the actions that women can take in terms of reducing risk for breast cancer, because unfortunately we can't ever fully prevent it. So even though we talk about cancer prevention, it's really risk reduction, because there's so many factors that come into play that lead to ultimately developing a cancer diagnosis. And so some of those things are out of our control, unfortunately, but some of them are within, and lots of the things that are within our control are also behaviors that help prevent and reduce risk for lots of other chronic illnesses. So things like reducing your alcohol intake, limiting that or abstaining from alcohol use altogether is definitely helpful. Things like staying physically active, maintaining a healthy weight. And a note about that, I think a healthy weight varies from person to person. So that's part of knowing your body, conversations with your doctor, and understanding what does healthy weight look like for you. And what things can you do to help maintain that and make sure you're maintaining physical activity at a level high enough to be helpful for your health. Also, in terms of breast cancer, I think one of the most important things is having really great familiarity with your own breasts. No one knows our body as well as we know our own. And so taking the time to really just be comfortable, feel around there, and really understand what it feels like, throughout your menstrual cycle, so that there's sometimes changes that happen there, just knowing what's normal for you, so that if something is off, you are likely to catch it. You're able to say, something feels different, and this change has been going on for some time. And a lot of people who are diagnosed with cancer actually find their tumors themselves, because they're so aware of the changes in their body, and they bring that to their doctor. So although it's really great to do things like screen, get your mammogram, all those things, especially when you are too young to do that, there's certain age ranges that it's recommended. Just kind of doing those self-breast exams at home. You also, when you go to your annual physical, which is definitely something you should be doing, and something that a lot of us are not great about staying on top of, so my tip for that is do it on your birthday or around your birthday. It's just that reminder to do it every year. But when you go, you can do a well women's exam, and that's also sometimes where they'll do a pap smear, and then also do a clinical breast exam, and that's where your provider will just do like a physical exam of your breast and feel around. So in addition to them doing that, you doing your own before you're old enough to do mammograms, that's certainly helpful to catch things early. But yeah, just really focusing on the things in your day-to-day, like maintaining a healthy and balanced diet, exercise, and reducing that alcohol intake, and then of course refraining from smoking cigarettes. So a lot of the things that you've heard before, and they seem very simple, very fundamental, but those are among the most effective things you can do to reduce your risk later on.
You mentioned in your introduction that you also provide psychological help for families. How important is that the families receive that help as much as the patient?
That's an excellent question. I'm so glad you asked that. So, especially in oncology, which is the field that I work in, there's a lot of energy that goes on the cancer patient or cancer survivor. And of course, that makes sense. However, cancer, unfortunately, is a burden that is felt amongst the whole family, amongst the whole community even. And especially if you are someone who is a caregiver or participates in caregiving for a cancer patient, it's a lot. You are not only helping to process some of the emotional trauma and emotional changes with that, but also doing a lot of the physical labor to care for them, taking the time off to help with appointments and things like that. And so it is also a very large burden on the people around the survivor and the patient. And so there's not always as much of a focus, though, on the well-being of those caregivers. And to be able to support other people, you also have to be supported yourself and feel like you're being rejuvenated and replenished in terms of your well-being as well. And so caregiver support groups, caregiver support resources do exist. And they exist within the Montefiore Einstein Cancer Center. But a lot of people are not really focused on that, or don't know to ask about that, or don't even really think about it because the focus is so much on their loved one who's dealing with the diagnosis. But I always say, again, you cannot kind of give your best self to others without first taking care of yourself. And so as a caregiver, it's incredibly important to receive that support, and also sometimes just to be in community with other people who are also caregivers and are also dealing with some of those same hardships, and being able to process that with people who really understand is just as important as the cancer patient receiving wellness support themselves.
So going back to your field, I'm also a senior in college and I'm studying to be a therapist. So I'm just kind of curious, how did your journey go to get to where you are today?
That's also a great question. Thank you for asking. So I was always very interested in psychology. I knew I was interested in biology, and actually thought, okay, I'm really interested in cancer. and I kind of thought it was either cancer and biology or psychology. And so I always had the interest in psychology. When I went to college, I chose my university for its specialty in psychology. And when I got to college, I was a little bit intimidated by sort of all of the very impressive things that were happening around me. So I went to Stanford for undergrad, and so you can imagine there are a lot of folks that I was around that were incredibly impressive, and I kind of felt like, well, I don't know if psychology is important enough. So even though I went to Stanford for psychology, I ended up switching to a pre-med track and majoring in human biology, and I was miserable. Not because I didn't like it, but it wasn't enough of what I liked. So I had this interest, but I was like, oh, this is not, enough of the psychology that I love, and a little bit too much of things that I'm not crazy about. And so about halfway through my undergraduate career, I kind of had a moment where I just had to really sit with myself. I was struggling, I was miserable, and it wasn't the experience that I had envisioned for myself. So I decided to make a hard pivot, and I completely dropped my major and my pre-med track, and I switched to a psychology major, and I had to declare a concentration within that, and I was very excited to find out that health and development was a concentration within psychology. And so that was sort of my way of still getting a little bit of that health in, but still focusing on what I was most passionate about. So I did that. I finished my major fortunately on time, and I was all set, and took some time off after I graduated, because I knew, okay, if I'm going to do psychology, I probably need to go to graduate school to really take this far, but I did not know what options were there for me, because I was so new to that field in terms of like my collegiate studies. So I took some time off to just do a little bit of self-discovery, which I highly recommend. You have time. So just kind of taking the time to really sit and ask yourself what's important to you, as opposed to letting that be dictated by a lot of voices around you. I took some time. It took about 2 years off in between, did some exploring, and that is where I found out that health psychology was a field, and there actually was a field that was a merge of the two things that I was most excited about, and that psycho-oncology specifically was a field. And so that sort of directed my search into graduate education and how I ended up pursuing my PhD in social and health psychology at Stony Brook University, which was because my mentor there, Ann Moyer, was focused on psycho-oncology and was doing the work that I was really, really excited about, that I didn't even know existed. So sometimes it's about digging through the weeds a little bit to go a path that is a little less traveled. Health psychology is a relatively new field, and so the examples weren't there for me. But it really just came from being patient, staying in my own lane, and just kind of following my heart through it until I found something that I was like, this feels right.
Thank you so much. Very insightful.
Hi, going back to your studying experience, would you say that like there were certain factors that were holding you back, not by your choice but by the system, as in your gender or your skin color, based on your environment?
Oh, absolutely. I think regardless of your socioeconomic status, where you grew up, your life experiences, ultimately being in this world as a Black girl and as a Black woman is going to have its challenges, and it's definitely going to color the way people treat you, the expectations they have of you, and their messaging to you about what you are and are not capable of. And for me, I was really fortunate to have parents that had resources to set me up, to put me in the best position for success. However, that did not change being surrounded by people who told me what I was not capable of doing, and sort of the struggle of trying not to internalize that, which was something that took a long time to work on, and is still something that I work on. So just this idea that, I know I'm smart, I know that I'm doing what I'm supposed to be doing, and yet there are people telling me, oh, that's not realistic, no, and just kind of discounting me just because I am who I am. And I can't control that, and so what I've learned to focus on is just the things that are within my control. I can only, I can't affect how people perceive me, what they say to me. However, I can change how I'm internalizing that or blocking out messages like that. And so that is a lot of what I have focused on, but still challenges all of the time. And just even to be taken seriously, whether it's in school, whether it's in the workplace, because of how I show up, is definitely something that I'm still working on navigating. And I always recommend for Black women to find mentors in the fields and in the spaces that they're navigating, because you have people who are able to kind of guide you, look out for you, and help you navigate a system that is designed to work against you always.
Thank you so much for that. We've heard some really, really great comments and questions. I wanted to ask you, just for those in the audience that don't know, would you be able to tell us the difference between a psychologist and a psychiatrist? And I know also you're going into a groundbreaking field of psycho-oncology. And what is that exactly?
Thanks for that question. So a psychiatrist is someone who is a medical professional by training, has been to medical school, and then branches off in a specialty of psychiatry. And so psychiatrists are able to prescribe medication, whereas a psychologist, while they can diagnose you with some type of mood disorder or psychological disorder, they are always not able to then prescribe the medication, right? So it's sort of that medical piece that's missing there, and that's different. And a psychiatrist, if you see a psychiatrist and you see a psychologist, it's more likely that some of the sort of therapeutic work is going to happen with your psychologist. Psychiatrists do integrate that, but I see a lot more psychiatrists, that kind of do enough to get a sense of what you're dealing with, but really focus more so on sort of the medication side of things. But they do both. So if you are not interested in going to medical school and you're not interested in having that piece, psychology is right and fine. And psychology generally is such a broad field, and there's so much you can do with it. Whereas if you're going into psychiatry, you're definitely going into a more, narrow pathway, I'd say.
I wanted to, I'm sorry.
Sorry.
Yes, okay, right. Exactly.
Psycho-oncology, yeah. So psycho-oncology is sort of the intersection of psychology and oncology. So we think about the psychology behind the experience of being diagnosed with cancer, with undergoing treatment, with living in survivorship. And I actually, in my graduate training, focused more so on the psychology of cancer early detection and risk reduction. So I was interested in things like, what keeps women from getting their mammograms, and how do we overcome that? And some of those things are, systemic and logistical things, but some of them are how we think about those things, how we prioritize certain things. So it's really the psychology about all things related to cancer and the experience.
We also talked about preventative measures, and I know that you said that breast cancer is probably not preventable, but in doing a self mammogram exam, can you walk us through that experience?
Yeah, so if you're doing a self breast exam, so it's interesting because the guidelines in terms of national recommendations have changed on that. They are not so much recommending it formally, and that may be because they are wanting women to focus a lot more on getting it done clinically through mammography and all of that. However, I will always tell people, continue to feel your breasts, continue to be familiar with them, again, because you can be the very first person to notice a change if you're that intimately familiar with them. But ultimately, it is about sort of feeling the breast tissue, even starting from under the arm, so kind of right in that armpit area, and then working your way in almost like a spiral, so that you're making sure you are kind of touching every part. And yeah, doing it like a spiral and working a spiral inward, and just pressing enough, with a little bit of tension so that you're able to feel the tissue. So that if something hard were there, or something, you feel kind of something that may feel like a pebble, or something that's hot, or something that's dimpling, just any change like that. If you're pressing enough and you're doing that regularly, and again, doing it through different parts of your menstrual cycle, because our breasts do change throughout the cycle. But doing that regularly, you're able to hopefully detect when something is feeling off. And it may not be anything, and also sometimes our breasts get cysts, which are totally benign, meaning there's no cancer. Sometimes it's just changes. But it doesn't hurt to bring that to a doctor and say, hey, felt something different. Can you check this out? And they'll likely just do a clinical breast exam themselves because they know what they're looking for. And if they do feel something, then they might recommend, let's get you in for some imaging. It may not be a traditional mammogram, maybe a sonogram or something like that, but they will take a look around and see.
Would you also be able to tell us statistic-wise, when it comes to breast cancer or cancers, period, a lot of black and brown women, well, the majority of us, we're going to the salons, we're getting a perm or a nail salon. Does that play a factor?
So that is a relatively newer area of research, and so I think we're still working on answers with that. Obviously, there have been some stories recently that came from a study about finding the link between chemical hair relaxers and development of reproductive organ cancers. And so we're seeing that tie and thinking about, okay, well, yes, we're using chemicals, and if you're using them on a very regular basis, every maybe 6 weeks or so for years, what is that? How is that changing? How our cells are reproducing in our body. And that's ultimately, right, what cancer is. It's an overgrowth of cells. When our cells are sort of ignoring their DNA instructions on how to multiply and how to function, and they kind of do their own thing and just grow out of control and take over. So ultimately, things that disrupt those instructions can lead to us developing that out of control growth, which can lead to cancer. So right now we don't have very clear answers about that, and even the recommendations around that yet are not, don't stop relaxers altogether necessarily, but because we're thinking there might be a link, it doesn't hurt to cut back. If you've already been on the fence of, letting go of the relaxers, maybe this may be that thing that pushes you over. So it's one of those things that as we're finding out answers, they're saying, maybe relax on that, pun intended. And, it doesn't hurt until we really have clear answers. And it will probably be some time, right? Because you have to think about, girls who are getting relaxers, for example, and when they're young, and then what that means maybe 40, 50 years later in terms of potentially developing cancer. May not be that long, but, to study that takes time. So I don't think we'll have very clear answers for a while, but I think continuing to read and just kind of adjusting your behaviors and what feels right for you.
Okay, so I have a couple of things to say on that, but then also, Kashay here has some questions, and I'm going to ask the questions for her because she's had surgery. So I'm going to ask her questions. Recently, she wrote a blog on affirmative action. So I'm assuming her questions for you are what affirmative action means to you, and if what obstacles and challenges, and I believe you had said that your parents had set you up well, so I don't know what that means with you getting in school or whatever, what part it played, but how does that affect those that are now going into school?
Yeah, so unfortunately, all types of diversity, equity, and inclusion initiatives are under attack right now. And our focus in all things related to that is not necessarily creating, an equal opportunity, but rather focusing on equity. So it's not about we give everybody the same thing. And so therefore, great, everybody should have the same chance at whatever outcome. But rather we're looking at the specific disadvantages that certain groups of people have, and then creating initiatives or creating programs or scholarship funds or whatever it is that help fill those gaps. And so it's going to be different from community to community, person to person. And so while all of those things are under attack, it's definitely disheartening because we've done a lot of work to progress forward. But I think you will see a lot about institutions' integrity as you see which institutions are trying to find creative ways to still maintain these initiatives and still work towards equity despite everything that's going on nationally. And so that might mean changing the language, kind of coding things a little bit so that they're able to still do these same things because they recognize it's important, not because they're mandated to do it. And now without a mandate, they're like, well, we don't have to do this anymore. And so I think that's a great signal for younger folks who are looking at schools and looking at programs to see, what does integrity look like within this institution, and how fiercely are they trying to protect their students who are benefiting from these programs that are meant to fill gaps, and which of them have abandoned them the moment that they were able to. And so that's definitely something that it's hard to know sometimes until you're in the institution, but there are signs. There are signs. And unfortunately, it's going to be an even trickier maze for younger people to have to navigate amongst all the other obstacles they already have to navigate to get where they want to be. And that's why I also would recommend reaching out and doing informational interviews with people who are at these places that you're interested in being a part of, whether it's faculty at a school or Black students at that school, and ask them, what is the experience like? And I find that informational interviews, whether it's trying to navigate this changing landscape or even just because you're trying to figure out your own career path or whatever, are always super beneficial because you get a chance to hear from people who are doing it, who are walking the path, who are living it, and able to tell you the things that they wish someone was there to tell them, years prior. So it's tough, it's tricky, but I think you have to do a lot more research, a lot more talking to people within those communities, and really put a lot more investment and trying to find those safe spaces because they do still exist. But
I think they exist, but I do think it's probably going to get harder. We have our HBCU colleges that are, that they're great, but I believe it was, I think it was one of the professors from Howard that had stated, the purpose of going to other schools might be the profession that you choose and the specialty with that school. So maybe for neuroscience, Boston University is the best school, maybe not one of the HBCU schools. So now I'm going to have a harder time getting in there, or maybe when it comes to a particular type of law or a particular type of profession that now you might be X'd out of. So it's almost saying like you're only going to be able to be this, you're only going to be able to be that. If it is that it's going to be a greater challenge and obstacle for you to go to those type of schools. So I think that's the really sad part about that, because I do feel like it also pigeonholes you. on what you can decide to be in life. You had even mentioned, sometimes people might have said, oh, you can be this, or you can be that, as opposed to what you want it to be. So this gives a greater opportunity for things like that to happen.
Yeah, absolutely. And unfortunately, you see it happening. I've definitely seen it being in graduate school. I didn't deal with that so much within my department, but I was very connected to other Black graduate students on Stony Brook's campus. And sometimes they would talk about specific professors or something that they felt a little bit pushed out, and that's not specific to any school. That happens everywhere. And especially if you are in a field where you don't see a lot of faces that look like yours. There's a little bit of that resistance to change. Unfortunately, a lot of humans generally, but certain groups of people are just very resistant to change. And so there's that discomfort, and there's that hesitance to sort of open the doors and provide the assistance needed, and sometimes even just that pushing out. And so it's tough because while you may, feel like I deserve to be exactly what I want to be and get my training exactly where I want to get my training, it can be tough to have to commit to dealing with pushback amidst, trying to navigate your studies, which is already difficult enough without people making it extra hard on you. And what does that mean for your quality of life over the 5-6 years you're pursuing a PhD, for example? So it's kind of got to weigh those pros and cons, and really just actively seek the supports. And that's why I always advocate and have played a part in graduate schools and also undergraduate schools, creating those groups and creating those safe spaces where at least there's a haven, at least there's someone to talk to, at least there's an advocate. And it's about sometimes finding those advocates who have a little bit more power than you do.
Kashay also wanted me to ask, what was your PhD thesis on?